Good morning, this is Kasturi Day. Today I've come to discuss the question answer of health and hygiene. Okay, so I'm starting with this chapter is according to ICSE syllabus class 8. Okay, so I'm starting with choose the correct answer. The communicable diseases are also called infectious diseases, acquired diseases, contagious diseases, none of these. It is also called communicable diseases are also called infectious diseases. Which of the following is a communicable disease? Malaria, cancer, allergy, or diabetes? The answer is malaria. Which of these is not a viral disease? Rabies, measles, filariasis and dengue. The answer is filariasis, that is caused by a roundworm, that is Eucheria bancrofti. Okay, now which of these diseases spread through contact with infected rats? Options are dengue, sleeping sickness, malaria, and plague. The answer is plague. Which of the following is a bacterial disease? Malaria, measles, plague, or dengue? It is the plague, which is caused by Yersinia pestis. Okay, it is carried by rats. Vector is the rats. Which of the following diseases is caused due to the animal bite? Malaria, tetanus, rabies, or tuberculosis? It is rabies. It is caused by rhabdovirus. Okay. Then acquired immunodeficiency syndrome could develop due to defective liver, defective thymus, HIV, or weak immune system. It is caused by HIV, human immunodeficiency virus. Then it is the process of developing immunity or resistance against a particular disease. Options are vaccination, pollination, immunization, and fertilization. Answer is immunization. Then fill in the blanks. Dash causes ringworm in human beings. It's the fungus. Dash vaccine is given to children as a preventive measure against tuberculosis. It is BCG vaccine, that is Bacillus of Calmette-Guerin. Okay. AIDS is caused by dash virus, HIV virus. The administration of the weakened pathogens to stimulate the immune system to develop resistance against that pathogen is called vaccination. Bites of poisonous snakes can only be treated with anti-venom serum. A dash is a crack in the bone which requires immediate medical attention, a fracture. The diseases that are transmitted from a sick person to a healthy person are called communicable diseases. Then communicable diseases are caused by disease-causing germs called pathogens. A protozoan called dash causes malaria, that is Plasmodium. In order to avoid chikungunya, we must avoid mosquito bite because mosquitoes are the carriers of the germs. So mosquito is the vector here. Now insects which carry the disease, carry the germs of diseases are called vectors. Now we come to true and false. Okay, so obesity and hypertension are communicable diseases. Obesity and hypertension are non-communicable diseases. So the statement is false. Chikungunya is caused by bacterium. It's false. The chikungunya is caused by virus. So we should wash our hands properly before and after handling food, after having food. Okay, so it's false. The statement is false. Then mosquitoes lay eggs on stagnant water. That's true. We should move and manage the arm of a person if we suspect a fracture. That's false. We should not mobilize that the arm of a person if we suspect a fracture. Now we come to the name the following. So the first one, the causative agent of measles, that is paramyxovirus. Then the causative agent of AIDS is human immunodeficiency virus or HIV. Then toxic extracts secreted by the pathogens which are made non-toxic. These are known as toxoids. A poisonous gas which is present in cigarette smoke, that is carbon monoxide. A break in the bone is known as fracture. Then we come to some differentiate between the following. First is dengue and chikungunya. Dengue causative agent is Aedes aegypti, and for chikungunya causative agent is Aedes albopictus. Then in dengue, there is a muscle pain on the back, arms and legs, joint pain on knees and shoulders. Okay. But in case of chikungunya, there is a joint pain on hands and feet. Swelling is present, and pains in the high in the morning. Excuse me. And then dengue, rashes usually arise on the face and the limbs, and for chikungunya, rashes arise in the trunk, limbs, face, palms, and feet. Dengue, there is hemorrhage, and in chikungunya, there is no hemorrhage. Okay. And in case of dengue, there is a life-threatening complications such as shock, breathing difficulty, and heavy bleeding can occur. Whereas in case of chikungunya, up to 10% of the patients develop chronic joint pain. Neurological damage is possible, but it's very rare. Then we come to the differentiation between personal hygiene and community hygiene. See, personal hygiene refers to the hygiene that is followed by a single person, whereas community hygiene refers to the maintenance of the hygiene as a whole community. For personal hygiene, the personal hygiene is dependent on a single person, and his relationship with the others would be affected through improper maintenance of the personal hygiene. If we don't maintain a personal hygiene ourselves, then that will affect others also. For community hygiene is about a number of individuals of an entire community. So improper maintenance of the community hygiene would make the entire community isolated from the others. Okay. Then we come to the differentiation between first aid measures provided in case of burns and first aid measures provided in case of bleeding. In case of burns, if it is a minor burn, then the affected part is immediately placed under cool running water, or ice cubes are placed on that affected area, applied so that blisters are not formed. And in case of bleeding, if there is a small cut, the area should be washed with plenty of water first. Then in case of burn, a soothing cream should be applied. If it is a minor burn, a soothing cream should be applied, or a paste of baking soda is applied on the area to reduce the pain. And if we see some blisters are forming, then we should apply some, the area should be covered with a light bandage, and then so that it is protected from fleas and dust. Okay. And then in case of if it is bleeding, if the small cut, then first we wash with water, and then we apply some antiseptic lotion, and the wound is covered by a clean bandage. Now, if the clothes of the person catches fire, if the person catches fire, which the person is wearing, that catches fire, we should take him from the running. We should stop him from the running, and then we should wrap the person with a thick blanket or a rug, or roll that person over the ground so that the air supply cuts off and the burning stops. The fire stops. The patient is given plenty of fluids and the doctor's attention is brought. Okay. And in case the wound is deep, in case of bleeding, if the wound is deep, then the wound is the affected area is raised above the heart level to slow down the blood flow and to that area, and immediate attention medical assistance is brought into action. Then Yeah, we come to communicable diseases and non-communicable diseases. Communicable diseases can be transmitted from an infected person to a healthy person, whereas non-transmitted diseases is not transmitted from one person to another, one infected person to the healthy person. Then communicable diseases are caused by pathogenic microorganisms, and in case of non-communicable diseases, they are caused by the tissue degeneration, nutrition, malnutrition, or hormone deficiency, or tumor formation, like that. Then in case of communicable diseases, they cannot be inherited from one generation to another, but in case of non-communicable diseases, they can be inherited from one generation to another. In case of communicable diseases, as it can develop almost immediately, it is acute. But in case of non-communicable diseases, as it develops over a period of time and lasts for long, so it can be chronic. Then in case of communicable diseases, that can be treated by traditional methods or therapies, but in case of non-communicable diseases, it is treated surgically or by some specialized methodologies. Okay, for example, communicable diseases is AIDS, typhoid, tuberculosis, malaria, etc. In case of non-communicable diseases, it's diabetes, cancers, etc. Okay, so I'll stop here. I'll continue with the rest of the question answers in my next video. Please go through this. If you have any doubt, please do write in the comment box. If you another thing I want to mention, that if you have any other suggestions, or you want any other subjects to be introduced, or ask you, if you want me to any subject to start with you for discussion, you can also mention in the comment box. Okay, and if you like the video, press the like button and share with your friends so that they can also be benefited. And if you are a new viewer to my channel and not subscribed yet, please do subscribe to get the notification of my next video. Thank you.